All right, Dr. Josh, thank you so much for joining the show today. I know that you've been very busy. For our viewers that are unfamiliar with Dr. Josh is not just a scientist. You are an infectious disease specialist as well as a physician currently treating folks battling the COVID virus that's sweeping the world. And I think today it came out that America, we're now leading patients or people that are infected with COVID. And
Uh,
so that's
that's
correct.
correct. Yeah.
So why I really wanted you on the show today is because we're seeing so many what's being presented as facts circulating the internet as well as the news. People don't know, like, should we be wearing masks? Should we be not out at all? And so what we want to do today is just go over kind of what you're seeing with your own eyes, treating the patients. But then also, I want to dispel some of the myths and rumors that I'm hearing, not only just with my crazy family and friends, but also I'm thankful enough to have some viewers that sent some questions just for you today.
Great. Good.
So first, can we talk about what are you seeing with your own eyes?
So I've had the opportunity to take care of a couple of patients who have COVID-19, and I just have to stress to your audience that this is very, very serious. I mean, what has been hard for many of us working in the profession is that this is really unlike anything we've seen before. And that's just from talking with people around me. You'll see social media posts that have come in from doctors all around the country where people who have been frontline providers in intensive care units for decades are saying, this is not like the flu. This is not like a really bad virus or pneumonia. This is beyond what we have seen before and what we've encountered within our lifetimes. I think what is very scary about this virus, and something that I have seen, unfortunately, in our own patients, is that people get bad really fast. And I mean really, really fast, such that within a matter of a few hours, you could have somebody who's just requiring just a little bit of extra oxygen to within a couple of hours, they have a tube down their throat and they're ventilated. And that's happened several times to people that we've seen. And I'd say that's a very common experience around the country. So that is, we see that rarely for other bad infections with other bad flu seasons like swine flu and stuff like that. But this happens with alarming regularity with COVID-19. And of course, we all know that the elderly and people with pre-existing conditions are more susceptible.
Mm-hmm.
But I'm here to tell your audience that we've seen young people go through this too. Certainly not at the numbers that happen with the elderly patients, but it happens to them too, and it can be life-threatening. And you never ever, if you can avoid it, ever want to be on one of these breathing machines. I mean, it's a long road of recovery. So my message is, I call it physical distancing, because I think socially we need to be closer now more than ever. Mm-hmm. Take the physical distancing and the shelter at home orders very, very seriously. Protect your loved ones, protect your neighbors and all of the people around you, because when we see this on the front lines, it is very serious and scary, even to the hardened veterans among us in the healthcare profession.
Now let's talk about some of the symptoms first, because we're seeing it vary between asymptomatic people, people not experiencing any symptoms, to the more extreme. Can you give our audience a good view of how vast these symptoms can be or varying?
I think this is something which has been surprising to a lot of people, and I'm sure confusing to the public. The majority of people, it's going to feel like a cold. And fortunately, 4 out of every 5 people who get this, particularly among younger and healthier people, are going to have cold-like symptoms. So fever, cough, it can be a dry cough, it can be a cough bringing something up, it doesn't have to be one or the other. Runny nose can happen, difficulty breathing, chills, kind of the usual stuff that you might get with a bad flu. But then there are people who and I think this is what confuses people. There's some people who may only have diarrhea, may only have stomach upset, may only have chills. And at the beginning stages of the disease, only 50% of people who get this coronavirus have a fever. So just because
Oh,
so I
wow.
think what's confusing is just because you don't have a fever or you don't have a cough, you could still have it if you have other concerning symptoms. And I think the thing that has really set off this coronavirus compared to all of the other really bad infections that we've faced just in the past 2 decades, like swine flu, pandemic flu, Ebola, even the original SARS back in 2003, is when those people got the virus, for the most part, they got sick. So it was really, it was rough for them, but it was obvious that someone was infected. Our problem, and the reason that it spread around the world like wildfire, is that there are people walking around our communities who are infected, who are completely well, and will never ever know that they have the virus. We'll never know that they even had it until we have a blood test for it, however long from now. So the problem is there are well-meaning, well-intentioned people walking around thinking they can't hurt anyone, who are spreading this to people who are potentially vulnerable and could die from it. And that's been there seems to be so many more asymptomatic people
That's
who
scary.
don't have some, and that's what's scary. And that's why the physical distancing and the shelter in place is so necessary. Because we can't tell who has it, the
Mhm.
only way to stop this thing from spreading is to stop people from contacting each other.
Wow.
Because, Joe down the street who looks well and is like running and exercising, if they go into a store and they're not wearing a mask and they're out talking and everything, like they could unfortunately be spreading it, and through no fault of their own. We don't have the capabilities right now to be able to find every single person who's infected,
So let
especially ones who don't have symptoms. So like you said, there's a huge range. There are people who are completely well, and there are people who are in the ICU, who die.
And it makes it tough because some of us have to venture out. I'm going to go to Instagram for a question for you because Sweet Little Dove, she says that her husband is a mailman. This is, you think about the postal workers, the people in the grocery stores, all of our medical professionals as well. Some people still need to go out. And so there's confusion also about how contagious is it? But her question specifically, she has two, but her first one is, can you catch the virus from packages? And how likely is it that you can catch the virus from your cell phone?
Oh, that I like both of those questions. Is there a risk that you could get it from packages? A small one, I think, is so. What I'll say is, have we studied this? Have scientists and doctors come and really nail down the numbers on this? Not yet. It's hard to do those kinds of studies. But in terms of expert opinion, what is the risk from getting it from packages, the mail, Amazon, things like that? It is not zero. It is probably small. And I have seen, I think a good practice is to leave packages for at least 3 days, maybe more. We do have information about how long the virus can live on different surfaces, and it's really not able to survive on something like cardboard or plastic very much beyond 3 days. So if you take those packages, so order well in advance, understanding that the packages are going to arrive and you're going to have to leave them in a quarantine for 3 days plus before you open them. And by that point, I would say it's very safe. I mean, I think the risk, even without doing that, would be very small. But if you want to bring that risk really close to zero, I'd take any packages or mail and then leave them in the garage or someplace where no one's going to touch them for about 3 days. Definitely after handling fresh packages, wash your hands with soap and water.
All right, we're going to wash your hands in 1 second. I want to go back to the packages real quick because when you're talking mail, usually people get their mail and open their mail. But I just want to be clear. You're saying bring that mail in, set that to some part of your house you're not accessing, because some people don't have garages. So some place you can, your porch if you have it,
Yep.
somewhere safe,
Yep.
and a bin somewhere off to the side for at least 3 days,
Yep.
maybe 4, but do at least 3.
Yep.
Can you, and this is where, because I have a lot of people that are DIY cats, right?
Yep.
Can
Sure.
you spray a disinfectant on the package before opening? And I don't mean like a box, I mean like your letters.
Yes.
Box from the grocery store.
So if you want to accelerate things, you can use a disinfectant spray. It's hard to find those nowadays.
Okay.
I've been actually trying and I can't find any. What I would advise is the thing that destroys the virus instantly is soap and water. So you're
Wow.
gonna look crazy. You're gonna look crazy. Your neighbors, whoever, are gonna think you're crazy. I do this. I take soap and water. I take just a plain paper towel and I scrub down the packages and things that come into the house. So after that, you probably killed it instantly. And just to be on the ridiculously safe side, and this is a little OCD on my part, I leave the soap down packages and letters for 24 hours. And after that, I open them.
Whoa. I
Yeah.
gotta up my disinfectant.
That may be a little extreme. That is not official.
I
Like,
don't know, I just kind of feel like if you're doing it,
this,
maybe we should be doing this.
that's just personal practice.
Okay.
But I'd say at a minimum, if you don't do that, if you don't use disinfectant spray or scrub down with soap and water, save those disinfectant wipes for things that can't get wet, like cell phones.
Okay. Okay.
I found recently the remote openers to cars. I think I just destroyed one
Oh, that's a
by
good
using
idea.
soap and water. So just use the disinfectant wipes for that.
Okay.
For everything that can get water, even if the mail looks a little raggedy afterwards, I'd use that soap and water.
And you said for cell phones, because that was what Sweet Little Dove was asking.
Again, scientists haven't been able to study this yet, but I worry that a lot of this epidemic could be spreading via people touching their cell phones, because where you hold your cell phone, up on your face, up on your mouth, up near your nose, and you just touch a little bit of that, and even if you just touch your cell phone, then touch your face, the virus is in, game over. So what I've taken to do, again, this is not official guidance, this is personal practice, and this was actually the advice of my wife. I give her credit for this, is if I'm going out in public, I minimize use that. Don't be that person in line wearing the mask
and on the phone.
all up on
yes.
No,
I've seen people pull their masks down
how this works
to talk on the phone. I'm like, you take your contaminated glove to pull your mask down to talk on the phone, and then start this whole process over.
It's all useless.
Okay.
If you give it any port of entry into your nose, mouth, or eyes, you have lost the game. So I take the phone, I minimize my use of it. I only pull it out in an emergency if I am outside the house, and I put it in a Ziploc bag, a watertight Ziploc.
Oh, that's smart.
But guess what? You can actually still use.
Touch it.
Exactly, it works.
Throw it away.
It works perfectly fine. When you get home, throw away the outside bag. So there's almost the only time germs, the virus will get on it is as you take it out. And then take a disinfectant wipe it down, leave it for 10 minutes, and then you can use it all you want in the house. But I do worry that because people are not understanding that aspect of, that where do you think the virus is going to come from? I think the virus is getting all up in these cell phones, infecting people. And people are going to be like, but I used a mask, but I washed my hands, but I used gloves. And it's like, it doesn't matter. You gave it that. So yeah, can you get it from cell phones? Definitely. I think this is an under-recognized problem.
So let's talk about washing hands, because this came from YouTube. Music for the Future's piano studio was wondering, why do we have to be encouraged to wash our hands and sanitize everything? Are we assuming that this will prevent us from receiving it, or is it more of establishing good practice that we're supposed to be doing this anyway? No, there's science behind this. You're not just trying to make us cleaner as humans on Earth.
So here's why the hand washing is, the answer is yes to both of those questions. Because here's the other thing. Not only do you prevent yourself from getting it, but let's say you would have been just fine, but if you had the virus all up on your hands and you start touching store shelves or a gas pump handler or whatever, like now you're putting those other people at risk. So if you wash your hands, you kill all of the virus on your hands, you protected yourself, you protected all those people who are going to come after you. So it's a self-protective thing, but it's also you doing your part to keep your community and those people who could get very sick healthy. Now, aspects of the science to understand the virus. So the virus, the outer surface of the virus is encoded by what you could imagine as a little layer of grease. It's like a little grease envelope that protects all of the parts inside. But just like grease on a plate, what happens when you put soap or detergent on grease or a grease stain in the laundry? Boom, it
Right,
blows
plus
apart.
those stains.
That same thing happens to the virus. And that's, you know, the virus is not strong in that way. It can stick on surfaces, but boy, the moment you pour soap or detergent on it, the whole thing blows apart. It's dead, instant, gone.
So we don't even really need sanitizer per se.
No, you don't. So you don't need
So,
to freak out about having run out of sanitizer,
mhm,
wipe, spray, all of that. I see on Amazon, all that's being directed to healthcare workers, appropriately so.
right.
Because at home, all you need is soap and water. And in fact, here in our house, I've been telling the household, let's conserve all of our disinfectant. If we can wipe down something with a paper towel and soap and water, let's do that. Where we used to use sanitizer a lot when there was a lot of it, now we just go to the sink, wash our hands. And frankly, I feel a lot more secure doing that anyway, because I know soap and water actually kills the virus faster than disinfectant sprays and
Say it one more
alcohol.
time for the people, please. So you're saying that soap and water, because this goes against any programming that we normally have. We tend to think if it's in a store from a manufacturer, and it's, you know, labeled something, it's going to be better than something basic that we can do at home. And so you're saying to kill the coronavirus faster, use soap and water
Yeah, super.
as opposed to
Yeah,
sanitizer.
yeah, the sanitizer and stuff. I mean, the sanitizer takes, you know, a minute or so to work, so it's not like that big a difference. But just because of what chemically the virus is made of on the outside, soap and water destroys it instantly.
And it's
I mean,
good to know.
you can just buy bar soap, and I see still plenty of bar soap on the
Wow.
shelves, and it's
Yes.
just fine. It's just fine. Yeah.
That's because we don't know. Like we
No, I
just,
don't know.
you know, people
Exactly.
just
You
don't know.
assume the pricey, fancy stuff is more
Correct.
expensive. In this case, it's not. Good old fashioned soap and water.
Okay, very helpful. Can we talk about the contagious, because here's what gets it like scary to me and confusion is that idea of airborne.
Yeah.
So a lot of us are thinking, for example, okay, if there's we touch the virus, maybe someone's spit was there, we touch it to ourselves. So now we start getting concerned about that 6 feet separation. And then what if it's a windy day? Does that make a difference? What if my neighbor gets it and it's a windy day? Does that make a difference? Can you shed light on how we can understand airborne and protect ourselves?
Right. So when we talk about airborne, there are two kinds of airborne that we talk about. There are when we talk, or when people who are sick cough or sneeze, um, they will produce these little droplets of saliva that really can only travel about 6 feet. So this is where that 6 feet physical distancing comes from. And then they fall down to the ground because that size droplet that they make is just too heavy. So the chances, even on a windy day, that let's say some runner runs past you and
Yes.
violates that 6 foot and is like around you for like maybe a few seconds, the chances that you would catch it from them is still really, really, really small. But even still, you want to maintain that 6 foot physical distancing to prevent any possibility that them just talking out on the open. So people just talking spray these droplets out. But again, they're heavy, so they fall after about 6 feet. Now, there is another kind of droplet that people make, and it's not as many, but these are smaller droplets that can hang in the air for a longer period of time. And so for those,
Like when you say longer, are we talking minutes,
so
seconds?
minutes, potentially hours.
Wow. No.
Yeah. But again, the amount that are produced even by people who are sick of those smaller droplets is going to be much, much smaller. The
Okay.
biggest risk that you have is going to be either around someone within the 6 feet who is sick and actively coughing and talking and sneezing. Like that's where most of the infections are going to come from. At this point, we don't know how much infection comes from the little droplets that hang around. And again, these are not ones that are going to travel far and wide and are going to be out while you're running around. I would think more like a store, there might be a smaller number of these around. Those are probably not the main ones causing infection. Main ones causing infection are when you're in close distance or when you touch your hand on a contaminated surface and then touch your mouth and your nose. So I don't want people freaking out and thinking like, oh my God, it's everywhere, I can't take a breath in. I don't think that's the case. And that's not really how people are going to get sick. You're going to get sick by fussing with your mask and touching your mouth and touching your cell phone. That's where it's going to happen.
Okay. Now, when you got a lot of concerns, you're getting kind of concerned. Okay. So what if I go to a grocery store, right? And we were initially told, for example, if you're not sick, don't wear a mask. But then you're seeing various states say wear a mask.
Mm-hmm.
And because of it, I'm seeing online tons of DIY masks or regular people. I know, for example, Ja Rule, Ja Rule, he's selling masks. And so my question is, yes, my question is, he's a good guy. Shout out to the Rule.
Yeah.
But am I going to be safe wearing his mask? Should I be looking for a specific filter? If I'm in a store, what should I wear to protect myself for droplets that may be present or, walking to past a sick person?
Right. So here's the trick. The reason that we ask people to wear masks is for the people, again, who don't have symptoms but who are sick, who are the well-intentioned people who feel fine, so they feel like it's okay to walk around in the community and without a mask on. So the Centers for Disease Control, the CDC, just changed their official guidance on this. So this is just within the past couple of days. They are now recommending, again, not forcing, but they are recommending that anybody who goes out in public, particularly in these areas like stores or you have to pick up, like mostly grocery stores at this point, wear a cloth mask. So that is now official guidance from the CDC. So I would go to the cdc.gov webpage and look to them for resources about which cloth masks and what ways to make them are most effective. And so I think you'll see like there are certain, I can't speak to Ja Rule, but I'm sure there are certain manufacturing methods that are more effective for this.
And that's why I want to look it up, because with the mask shortage and you're seeing hospital workers, medical workers, and we normally get the hookup. My nephew's a medical worker, right? And I'm like, dude, you got some masks? Nah, we don't even got gloves. For, other people himself.
Yeah.
But now my concern is if people are selling them online, how do we make sure we are protecting ourselves? But what I think I'm hearing you say, and I need to make sure I'm clear on this, the mask is really to protect the other people that aren't sick. So technically, if I'm wearing a mask that's like my handkerchief, I wouldn't necessarily be protecting myself from the virus.
Yeah. So there is a lot of debate and confusion even within the community of doctors and scientists about this. Okay. Let me distill everything, all the confusion down from what I've seen to the listeners. The big thing with using the cloth masks is you're protecting the people around you. Does the cloth mask protect you? My opinion from having seen everything is probably. It is probably protecting you. So for many of these cloth masks, if they're made correctly, the big droplets, the ones that travel about 6 feet and go down, which is probably the main way this virus is spreading. Can I point to a scientific study that says the cloth masks protect against that? No, but are they probably protecting against it? Yeah, I think so. I think if you have that much covering, That's of course, if you think there's a droplet, like a droplet of saliva, and it encounters it, it's going to have a much harder time getting to your nose or your mouth if it has to go through a cloth mask than if there were nothing there. So I do think you are getting some protection. We don't really know how much, but I do think it's probably better than nothing, and it may be a fair amount of protection. We just haven't had the chance to really like measure it in a laboratory. Um, it, you know, does it protect you against the really, really small droplets? No, but again, that's not really the way that we think the virus transmits out in the community. Like there are some medical procedures that can produce droplets like that, again, that's why the healthcare workers have to wear the specialized N95 masks that filter even those really, really small droplets. But it's really the big droplets out in the community. And so cloth masks probably help against that. But definitely, and there is research on this, it definitely does protect against you giving it to other people unknowingly.
And that's what we need to do, stop the transmission.
So stop the transmission. So the summary of all this, the recommendation is, when you go out in public, wear a cloth mask. Find a cloth mask manufacturing method that is compatible with what CDC is recommending. Hopefully, Ja Rule is doing that.
Come on, Rule. We need you. We're depending on you.
Exactly. The medical masks and stuff, and this, the awful like stockpiling that you've heard the bad stories of people selling these at a markup. Part of the reason we're asking people not to get those is to save those for the medical workers. I mean, you've heard the horror stories from Italy, Seattle, New York City, forcing people to work without these, or reusing them over and over again, which they were not built to do, but we have to do. At this point, I'm doing that. I'm reusing masks that were not built to be reused, but it's because it's all we got. There's no other supply behind this. So for you and the listeners, please use cloth masks. Donate your medical masks to a nearby.
Wow.
No.
Sorry, you hit me with some stuff that's kind of making me like way heavy on my chest, but that's when you know it's bad. I've been hearing too, we'll talk about the medical workers in a moment, because I want to go back to the grocery store, because I do have a question from Instagram about gloves. Ves3266 from Instagram says this: is it really safe to wear gloves with all the cross contaminations that gloves carry? And I think this is a good question, because I used to be a sandwich artist. Do you know who's sandwich artists? Subway workers. So back in the day, you wasn't like, you were a Subway. I'm a sandwich artist. Like that's like my first job on a resume, right?
Yeah.
But anyway, I remember in like the training, they said, what's cleaner than these gloves are just washing your hands to make a sandwich. But the public, they don't like seeing it. So we wear gloves, but technically the gloves are in a box. That's dirtier, but the public feels like it's clean.
Yeah, it's the illusion of being clean.
The illusion of clean.
I mean, if you change your gloves you're supposed to be washing your hands between everyone also. So, but yeah, I mean, if you change your gloves every time, I'm sure the sandwiches are fine.
Right.
Yeah.
You're supposed to, but they don't. Anyway, we'll talk about that later. Some people, as the consumer, if you're ordering anything and someone has on gloves, you should say, "Can you please change your gloves?"
Yeah. Yes.
Yeah. But back to Corona for a second. He does bring up a good point. He's, just curious about like, is it cross-contamination with these gloves?
Yes. Yes, there is. If you're not using them correctly, I mean, you actually just hit on it with the Subway example. Like the gloves do nothing if you're not hand washing before you put them on, every time after you take them off. And heaven forbid you're one of these folks you've seen on Twitter the photos of people like touching their mouth and stuff and touching their self
with gloves on. I've seen that.
What you doing, guys? What are y'all doing? So yeah. So when you use your gloves, and this goes for the cloth masks too, the way to treat them, to be able to protect yourself from getting infected, it's fine to use it, but you have to pretend like all of that after you've used it out in the community is covered with the most disgusting thing imaginable. So if you think about it that way, how would you treat those? So every time I have gloves, I try to when I take them off, I just try to slip my thumb under. I try
Mm.
not to touch the outside, turn it inside out. And then
Mm-hmm.
the other side, slip the thumb under, take it inside out, trash immediately, straight to a sink, soap and water. You know, your cloth mask, don't touch anywhere here. Treat all of this with your cloth mask. I treat all this as if it was just coated in coronavirus.
Wow.
Every outer surface. When you get home, wash your hands before you touch your mask. Take the mask off from behind your head so that your hands don't come anywhere near your nose and mouth and eyes.
Mm-hmm.
You take that mask and you put it straight in either like a plastic bag, or you, if you can, put it straight in a washing machine. And again, just like for soap and water on your hands, detergent, which is soap,
Mm-hmm.
will, when it runs through the wash, all that is clean. You know, you've destroyed the coronavirus. It loses.
And I just want to be clear. So you're suggesting if we're using a cloth mask or any type of glove, let's say it's reusable, you should be cleaning it each time you use it.
Exactly. I mean, I hope that, you know, if you have, the gloves are not as necessary, the mask certainly is necessary, and you'll reuse those, the cloth ones. I would try to dispose of the gloves if at all possible. If for whatever reason you really need a pair of the disposable gloves around, I would soak them in soap and water. And I
Mm.
would check them if you really have to reuse them, which I do not recommend. But if you're forced by circumstance, you need to check them very carefully for holes before every usage of them. But I would recommend throwing the disposable gloves away.
Now, let's say worst case scenario, you're sick, right? Because I know a lot of people, it's allergy time. You're like, do I have allergies? I'm going to give a quote that a family member actually said to me.
Mm-hmm.
Wild. Yeah. The quote was, I'm not going to get tested because there's no cure. So first I'm going to ask you to explain the difference. I'm just going to send a link to said family member. Explain the difference between treatment and a cure.
Right. So a cure is, we can give you some medicine and the disease will go away, you know, wonderfully. And we have some of those. A treatment is, we can't get rid of the disease, but you'll get sick enough that you probably need some other support to take care of symptoms to help you to feel better. So we don't have a cure for COVID-19, but if we did not treat some of the people who were really sick with extra oxygen, they would die. So cure can get rid of it. Treatment is really to support people through the disease so that they come out of the other end and they're okay. There are some, even in the absence of a cure, a lot of people definitely need treatment. That decision needs to be made by a physician or someone from, or a licensed provider.
So let's talk about what that would look like. Personally, I know several people that unfortunately have it. One person is a nurse who treated a patient who has it.
Right.
And her concern is, you know, how do I get tested safely?
Mm-hmm. Yeah. So,
What
I
are
mean,
some of the options?
so I'd say for healthcare workers, I would speak with, definitely look to your institution's guidance on testing, if particularly if you come down with symptoms. And again, like we talked about earlier, it could be any range of like cold symptoms or even like diarrhea symptoms. So I'd speak with your institution to see what their testing procedure is and what their recommendations are for while you're waiting for testing, whether to shelter in place at home or not.
Mm-hmm.
Now, for people not in healthcare, this is really important. I think a lot of people don't know this. If you start to feel yourself getting sick, but it's not to the point that you feel like it's really, really bad and you need to go to an emergency room. Like if you don't feel like you need to go to the hospital, but you are sick, call your doctor's office or call an urgent care, because all of them have procedures now or a checklist they go through to evaluate whether you're at risk for it and whether you qualify for testing, which are two different things. because we still don't have enough tests available, particularly depending on what part of the country you're in. They're really saving tests for the people who are most critical, hospitalized, and healthcare workers. So I hope that you live in an area where you're able to get testing, but definitely call a doctor's office first. Give them the story over the phone, and they will tell you whether you need to go to a testing site or not. They may just say, like, it sounds really mild, like for now, just shelter in place at home, and you got to wait 2 weeks and find people who will be able to bring you stuff, to get you food, while you're in quarantine. For some people, they might say, like, that sounds a little more serious. Please come to one of our drive-through or remote testing sites. But the doctor has to give you an order saying, I'm saying that this person needs testing. If you roll into one of these sites without like a doctor's order saying that, usually those, if they feel like you need a test, they will actually help schedule you or tell you where to go. Definitely ask that question if it doesn't come from the person on the other end of the phone, like, where do I go for testing? What documentation do I need to show them? What time is the appointment? So like get all that squared away. So when you roll up to the testing site, it's just they swab you, and then ask them, how will I be contacted with the result? And when should I expect to hear the result? And when should I call if I haven't heard yet? So make sure you have all that information about the communication about the testing result. You know where to go in advance, you know what time, and you have all the documentation we need. So when you show up there, they don't give you any pushback.
And that's good. You said, when should I call if I don't hear results? Because I heard another person who has it, unfortunately, took a test and they never called the person back to say, hey, you do have it.
Yeah.
So
unfortunately, places are
very helpful for us.
so swamped right now that they may be remiss or delayed in follow-up because of the flood of testing, and they're just not able to keep up. Again, through no fault of their own. They're just, the health system is just overwhelmed right now. The one thing I will say about testing and staying at home is, the main thing is, if you feel it yourself getting much worse, like you feel like you might need to go to the hospital, and particularly if you develop difficulty breathing, go to an emergency room, period. Because like I said, when people get sick, and having seen this unfortunately, if you start to have difficulty breathing, go to an emergency room, because things can go downhill fast, and you want to be seen by a doctor quickly. If you just have cold-like symptoms and you're feeling okay otherwise, please just stay at home and away from the health system, except for instructions to test. But certainly if you're feeling really ill and feel like you might need to be hospitalized, like, go to an emergency room right away. Take it seriously.
Okay, let's bust some myths really fast, because I know you actually have to get back to working. Again, let me just thank you for even taking this time out
You're
for
welcome.
us, because I'm in my mind, I'm like, we have to go. Let me go to the source, somebody who's there on the front lines that can really give us a better idea and weed through all the things that we're hearing. So,
and if you want to call me back, if this elicits other questions or more discussion, because this is a long-term thing.
okay.
And I'm happy to be present for your community of listeners and to be able to
Thank
answer
you
more
so
questions.
much. We appreciate that. Here are some of the myths that I'm hearing, and you tell me if this is true. If you hold your breath for 15 seconds, hold your breath for 15 seconds. If you don't cough, you don't have coronavirus.
That's garbage. That's something circulating on an email chain. There is zero evidence behind that. You could hold your breath for 15 seconds, not cough, and still have coronavirus. That's
okay. What about drinking hot water every 15 to 20 minutes flushes the virus out of your body?
The coronavirus laughs at you as it watches the hot water go by. No, hot water doesn't do anything.
Okay, what about flushing your nose? I've seen people, they hold their head over a boiling water. They're like, put some lemon and some citrus.
My reaction is just that when you're flushing with water or saline or whatever, you may actually be spewing more of the virus out into your environment and putting other people at risk. I would only recommend that if you are in a contained space in quarantine and there's zero chance anyone else is going to be anywhere near your vicinity. For the most part, I would I understand some people try to do that to relieve congestion.
Oh, they're saying you won't get it.
Oh, no, again,
Not a treatment.
no, no. That's
There's
another situation where the virus laughs at you
okay.
as the water washes by,
Laughing
while
virus.
it's already inside the cells in your nose. Yeah.
Okay. And what advice do you have for us people trying to tell our parents to stop having old folks parties at their friend's house? There are a lot of people having wine Wednesdays. Oh, I just go to my best friend's house and we just hang
If
out
that friend
together.
gets sick, they end up in an intensive care unit.
Okay.
They die. And sometime down the road, or you were just left wondering, what if I had it? And what if I just didn't have symptoms and I gave it to them? Do you want that on your conscience?
We don't want that.
I would have told the spring breakers in Florida the same thing.
Right.
They seem to not care. But they're killing people. You don't want to be that person. Save lives.
Speaking of saving lives, do you have advice for medical workers? And I've been getting various reports of this, of them either dealing with people that have coronavirus and not having the equipment that they need and still expected to come to work. And then some people with the coronavirus, with presenting symptoms as well, and being told you're still expected to come to work. I heard one hospital in New York, entire floor of nurses tested positive for the virus and still they are coming to work.
So New York City is a very different situation from most of the country, just because they're really, there's nothing left in terms of resources and personnel, and so many people out sick and just overwhelming numbers of patients. I would ask their hospital for guidance, and I would try to understand if they're asking people who have tested positive for COVID-19 to come to work. That just sounds.
But I'm hearing this in Virginia as well.
Ugh, in Virginia.
That's what makes it kind of, alarming to me to hear this in different places.
I don't understand why healthcare organizations would ask people who are known to be positive, test positive, to come to work, because all you're going to do is infect more people who are healthy in your workforce and knock them out. I mean, once you're sick, the mask and everything that you do, inevitably you'll still be spreading it around your workplace. I don't understand those policies. I'm not in that position, so I'm certainly not in a position to judge. But it seems to me that if you want to stop the virus from spreading, it seems like it's short-sighted to send sick people to work, because you'll get staff sick and get them out of work. So if you've just made your staffing problem worse, and God forbid you get patients or their families sick, and which is completely against the oath that we take as medical providers. And kind of less importantly, but realistically, opens you up to a lot of lawsuits. If patients or families knew that you knowingly sent people with COVID-19 to work, you're exposing yourself to a lot of liability.
Wow.
Yeah.
Well, our medical workers, people like yourself that go out every day, we just want to, let me just say thank you on behalf of everyone that I know and of the world, because you guys really are our heroes at this point, fighting every day. Even hearing you say, I'm using masks that aren't supposed to be reused, but we're doing the best that we can with what we have to help the people that are really battling this, sick enough to be hospitalized, So I just want to thank you for that. And everyone that's in health workers that are watching, thank you as well. For us that are the people of the world, where is a place, what could be a safe resource, in your opinion, that's more aligned with what you're seeing in the field? Where can we go if we need more information?
I think the Centers for Disease Control website, cdc.gov, has the best and most reliable information for the public in terms of how to keep themselves safe, everything about shelter in place and physical distancing, or what's being called social distancing, physical distancing. So I would go to cdc.gov. And like I said, even with the cloth mask thing in public, that guidance updates some fairly frequently. So at least a couple of times a week, check out, see if there are changes on the cdc.gov page.
Perfect. Again, Dr. Josh, thank you so much for taking time out to just be here for us.
Thank you for having me, Danella. I'm glad to be able to share this with your listeners. And I want to wish everybody a happy Easter.
Oh, right. Yes.
And to you as well. Happy Easter to you and the family.
We were like, oh my gosh, Good Friday happened. What happened to Lent? Some of us joke that we gave up people for Lent.
I know. In the midst of the darkness that envelops the world, I think we can all look to Easter and look to the hope of Christ's resurrection as a message to us for the choices that we make in the midst of this pandemic and the way that it will affect the people around us. So, love and Easter prayers to the world, to all of your listeners, and thank you for this opportunity.
Thank you. Okay. Well, I almost want to say I don't want to see you again. Mm-hmm. You know what I'm saying?
Right.
But thank you.
Yeah, you're welcome.
For when I will see you again.
Yes, I'll be ready.
Thanks again. And thank you to all the viewers that have joined us, every single person that wrote in a question. If you have any additional questions, again, you can leave them in the comments on YouTube. You can email me as well, Danella@DanellaNOW.com. And as Dr. Josh said, he would be willing to come back on this platform to answer more questions. So we just hope that this will be helpful to everybody. In the meanwhile, please be safe. And we just want to send love out to everyone. Thank you again for joining us.